everybody gets something. They die of something. I guess old age would be the best thing to die from.
I don't know. I'm not ready to go yet, but I've had a good life, and when it's time, why, it'll be time.
I watched my daughter take her first breath, and I watched her take her last breath. And I was praying that she would go soon so that she wouldn't be in pain.
But each person sticks with you. I've worked for Pathways for almost 3 years now, and I know the name of every patient that I've taken care of. I can still remember, their daughters and sons' names, their spouses' names. I mean, they make a big imprint on your life, and they change you for the better.
Michelle was an organized, delightful, outgoing young woman. She was my daughter, and I loved her dearly.
So I take care of patients that have been judged to have a terminal illness. I go to the facilities that they reside at, whether it's skilled nursing or assisted living, and I help the staff there take good care of them.
I've done a lot, I think, in the time that I have, and I think I'm pretty well respected.
I don't know if I'd really miss, I'd miss being alive. I miss doing things.
Well, it's taught me that we don't face it very well in the United States in particular, that it's always the gorilla, the 800-pound gorilla in the room, that we don't talk about it, and we need to have that discussion. Every adult child with aging parents needs to have that discussion with them, and they need to have it between themselves. Spouses do, and you need to take a look at children as well, that we're all born and we're all going to die, and it's how do you do that in comfort and care and with dignity? And if everybody's on the same page and they're not afraid of it, it's the fear factor, it's the unknown. And while none of us have ever died and come back to tell other people what it's like on the other side, I don't think that, to me, there isn't any fear at all involved in it. It's just a profound privilege to be there with somebody at the very end. So I don't leave anybody with any other impression as there isn't anything to be feared about it. It's a common process that we're all going to go through, and I think each person needs to think about what that means to them and what they would like for themselves at the very end so that they can let their loved ones know, and then it should be the way they want it to be.